patience in the coming days and weeks. We are certainly still managing a scarce resource. There is not enough vaccine yet to give everyone who is eligible a shot when they're ready. But our phased approach of incrementally adding in seniors each week will help avoid some of the nightmares we've seen in other states when seniors become eligible all at once and often with several other priority groups. I want to be upfront with you in saying that there will still be some hiccups in this process, but we are going to get through them. Signing up for an appointment will also look different based on your community and your healthcare provider. This is certainly an all hands on deck effort. Director Allen will share more, including details of a new online tool that Google helped us create called Get Vaccinated Oregon to help Oregonians who are eligible for a vaccine. Seniors with questions can also call 211 for information. And to help ensure the phone lines are running smoothly, I am deploying an additional 30 National Guard members to help staff the call center. Our National Guard members have already helped in extraordinary ways, having administered more than 44,000 vaccines to Oregonians. That is 58% of the total vaccines at the sites they are supporting. Thank you to our National Guard, and thank you to their employers who are sacrificing while they help in this incredibly important effort. I know that Director Allen has more to share on how we're connecting seniors to vaccines, so I will turn it over to him in a moment. But before I do that, I wanted to address the hearings that have taken place this week regarding Representative Diego Hernandez and the investigators' findings that he created an intimidating and hostile work environment. The women who came forward and shared their stories are courageous and brave. Let me be very clear. If this were any other workplace, Representative Hernandez would have already been shown the door. While the legislative process will proceed to address findings, quite simply, his behavior is unacceptable for anyone, never mind an elected official. He should resign immediately. With that, I'm going to turn it over to Director Allen.
Thank you, Governor Brown. Good morning again. I'm Patrick Allen, Director of the Oregon Health Authority. Dr. Dean Seidlinger, our State Health Officer, is also here on the call to help answer questions. This morning, I want to give you an update on the pace of Oregon's COVID-19 vaccination program. I'll update our timelines for vaccinating seniors. I'll tell you how we're planning to connect older adults and the people who care about them or care for them to information about when, where, and how seniors can get vaccinated. And I'll tell you when people who are next in line after seniors can expect to become eligible for our COVID-19 vaccine. As we go through today's briefing, there are three things I want every Oregonian to keep in mind. First, if you live in Oregon, you're less likely to get sick with COVID-19 than people in most other states, thanks to the hard work and sacrifice of so many Oregonians. You're also more likely to have been vaccinated than people who live in most other states too. Oregon continues, as the governor said, to have the fourth lowest COVID-19 infection rate in the nation, the fourth lowest death rate overall, and the fifth lowest death rate for seniors in the country. And Oregon vaccinators have now administered more than 500,000 doses. But despite all our progress, we know this pandemic is far from over, and we face many challenges, including a short supply of vaccines. Therefore, second point, I'm asking older Oregonians for patience in exchange for this promise. While it will take time, every senior who wants to get vaccinated will get a vaccine in coming weeks. The amount of vaccine Oregon receives from the federal government remains scarce. Not every person 80 and above will be able to get vaccinated on February 8th. Many seniors and their family members will be frustrated in trying to secure a vaccination appointment next week. However, from across the state, health authority staff and our partners at vaccination sites are doing everything we can to connect you to vaccine information. It may take several weeks, but we will get you vaccinated. And the third point is that today we're announcing an important adjustment in our vaccination timelines. Throughout this pandemic, Governor Brown and I have been committed to transparency. At previous news conferences, we've said it could take until early May or later for Oregon to be able to vaccinate a critical mass of seniors. While it's been suggested that the governor and I have overpromised in our timelines, we've always said our ability to vaccinate Oregonians depends on three things. First, the supply of doses we receive from the federal government. Second, the number of people who are eligible to get vaccinated. And third, the capacity of Oregon vaccination sites to administer doses. So let's tackle the last factor first. Today, vaccination sites across Oregon have the capacity to vaccinate at least twice as many people as we have vaccines to administer. We've had days where we've vaccinated 20,000 or more individuals. That leaves supply and demand as the remaining limiting factors. If our supply of vaccine keeps pace with an expanding number of people who are eligible, we can stay on track. But if it doesn't, then we'll fall behind. As you know, in the next 4 weeks, about 700,000 Oregonians will become eligible to get vaccinated. Not only will we vaccinate seniors, we're also vaccinating adults in custody. At the same time, our supply of doses from the federal government is changing. The combination of those two variables, our eligible population and the amount of supply we receive, means we are constantly recalibrating our timelines. So today, we want to inform you that Governor Brown and I need to change the timelines we've promised. Here are our new timelines for seniors, educators, and the Phase 1A population. By early April, we expect to have allocated enough vaccine to immunize 3/4 of Oregon's currently eligible population, including seniors. By early April, we expect to be in a position to move on to the other Phase 1B groups. That date is about 1 month earlier than we initially projected. That's good news for seniors. It's also good news for frontline workers, people with underlying health conditions, and others who are next in line. As always, this projection is based on the latest allocations of doses we expect to receive from the federal government and the throughput capacity of Oregon vaccination sites. OHA has shown we can get vaccines to partners who in turn can get them into the arms of Oregonians, but we need the federal government to continue to deliver the doses they've promised us. But before we get into the details, let's start by looking at how Oregon is doing in distributing vaccines. As of February 4th, Oregon had administered 509,582 total first and second doses of COVID-19 vaccines. Yesterday, Oregon vaccinators administered at least 12,898 doses. Oregon is tied for 12th in the nation in the percentage of population given at least one dose at 8.8%. We rank 16th in the nation in percentage of vaccine administered at 67%. Over the past week, Oregon vaccinators met Governor Brown's daily target of administering 12,000 doses per day. And in fact, as of today, the 7-day rolling average is 15,973 shots per day. As we've said all along, our limitation isn't capacity, it's supply. Now let's dig a little deeper into the vaccine allocation numbers I mentioned previously, see where our new doses are coming from and how they'll speed up our timelines. As you can see on this slide, there are about 550,000 people currently eligible for a vaccine in Oregon. That number includes approximately 400,000 people in Phase 1A, such as healthcare workers, first responders, people who live or work in long-term care facilities, and people with developmental disabilities and other qualifying jobs or conditions. It also includes approximately 150,000 educators and other staff who work in childcare, early learning, or K-12 schools. By the end of this week, we expect to have administered close to 420,000 first doses, enough to cover just over 75% of the people in these groups. Starting next week, we can anticipate some big changes in eligibility. We'll begin opening eligibility to the first group of seniors, starting with people age 80 and above. We're also allocating enough first doses over the next 2 weeks, starting with 5,000 doses this week to correctional facilities to vaccinate adults in custody in state prisons. We will also begin to provide vaccine for people in county jails, along with youth in Oregon Youth Authority facilities. The addition of seniors over the next 4 weeks accounts for the steep hill we have to climb, taking us from our current total of 550,000 people eligible to more than 1.3 million. But there are two factors that make that hill less insurmountable. First, we've already vaccinated more than 100,000 people over age 60, including 28,000 people who are 80 or older. Second, we're getting a significant infusion of federal vaccine supply. Where are these doses coming from? Two sources. The Biden administration has increased allocation of the Moderna vaccine. For Oregon, this represents an additional 11,600 doses per week. In addition, Oregon has opted into the federal retail pharmacy program. Through that program, Oregon will receive an additional 12,000 doses per week starting next week, which will be distributed at 133 retail pharmacy locations across the state. As a result, our weekly allocation of first doses will increase from 52,000 per week to more than 75,000 per week. Those increased allocations add up to a cumulative first dose allocation of 1.2 million by the week of April 4th. In other words, by early April, we'll have enough vaccine supply to meet demand for more than 75% of everyone eligible to receive a vaccine at that time, including every age group of seniors, all remaining educators, and anyone remaining from phase 1A. As I said earlier, that's about a month ahead of our previous estimates. Our accelerated pace also means that we will be ready to move on to people in the next set of phase 1B groups by early April. These groups would include people in frontline jobs and people with underlying conditions. Finally, let me add that none of these calculations take into account the authorization of any new vaccines. Yesterday, Johnson & Johnson applied for emergency use authorization for its COVID-19 vaccine. Having another vaccine that's been proven safe and effective would be welcome news. But until new vaccines are authorized and we begin to receive allocations, we won't factor those potential doses into our projections. Now, let me temper all that good news with a word of caution. Next week, when seniors begin to become eligible, we will see some degree of chaos. Next week, many older adults will inevitably voice frustration. Next week, you will not have to look hard to see people experiencing confusion. We will fall short. As much as we want to offer every older adult seamless access to a vaccine next week and over the rest of this month, the numbers don't lie. The gap between our eligible population and our allocated doses will be wide at first. As much as we want older Oregonians to have a simple, convenient consumer experience, we're still building a new vaccine distribution system to respond to a novel coronavirus pandemic. There will be gaps we'll struggle to bridge for many people. And while the same confusion and frustration reigns for older adults trying to find vaccines in every other state in the country, we're working hard to reduce the amount of chaos we see here. So, how can older adults get a COVID-19 vaccine? Like other eligible adults, seniors can get vaccinated through local public health authorities or their partners, including hospitals, public vaccination clinics, and in long-term care facilities. Starting soon, some seniors will be able to get vaccinated at some retail pharmacies. In most counties, older adults won't be able to get vaccinated at a doctor's office, though some counties are making that possible. The options available to an older adult will depend on the county they live in. Vaccines are scarce, but as we've shown, Oregon gets more doses every week. By early April, everyone who wants a vaccine should be able to get one. It's just going to take some time. While vaccine providers won't be able to schedule an appointment right away, we can offer different ways to get linked to vaccine information and events. Here are some of the ways older adults can stay informed. New tools on covidvaccine.oregon.gov. OHA's vaccination website features facts about COVID-19 vaccines. As of February 8th, 2021, the website also includes a new tool, Get Vaccinated Oregon. This tool will allow people to determine if they are currently eligible for a vaccine and register to get email alerts or text notifications when they become eligible. Once you're eligible, the tool will help direct users to vaccine events in their area. The tool will be open to all Oregonians. Using this tool does not guarantee users a specific place in line, but it will help you find a vaccine event in your area. As of February 5th, vaccine information by county will be newly updated on OHA's website at covidvaccine.oregon.gov. The site will include specific information about where an older adult can access vaccine in their area. For people who live in the metro area, a chatbot on the website is also available to link you to local events. Get vaccine information from 211. Older Oregonians can also text or COVID, ORCOVID, to 898-211 to get text updates about vaccination clinics. This option is available in English and Spanish. Seniors can also email or COVID@211info.org. If you can't get your COVID-19 vaccine questions answered on the website or by text or by email, you can call 211 or 866-698-6155, which is open from 6 a.m. to 7 p.m. daily, including holidays. Please be aware that wait times may be long due to high call volumes. As Governor Brown announced, the Oregon National Guard is helping 211 answer phones. Finally, pharmacy partners are vaccinating residents and staff at most licensed facilities for older adults and people with disabilities. Residents or family members can ask their facility operator when their residence is scheduled for a vaccination clinic. We're now at a point where the number of Oregonians who've been vaccinated against COVID-19 is more than double the number of people who've been diagnosed with the virus. But that doesn't eliminate the risks we face or diminish the lives of people we've lost to the pandemic. Today, we mark another grim milestone in Oregon's fight against COVID-19. As the governor mentioned, Oregon has now recorded 2,002 deaths associated with the coronavirus. Our 2,000th person lost was a 90-year-old woman in Yamhill County who tested positive on February 1st and died on February 2nd at her residence. She had underlying conditions. At this stage of the pandemic, many of us have seen family, friends, or neighbors die from COVID-19, or we know people who have lost loved ones. Many of us at OHA grieve the loss of our own family and friends. Every loss weighs on us. I want to extend my deepest sympathies to every family who's mourned a parent, sibling, or child who died from a COVID-19 infection. As each death keeps us focused on preventing others from dying, as I said at the outset, Oregonians have made a difference. While each death is tragic and preventable, your sacrifices have prevented the deaths of thousands more. Those are the stakes we're facing. Nearly a year into the pandemic, more than 8 in 10 Oregonians continue to wear masks indoors in public places. The majority of Oregonians are limiting social gatherings and staying 6 feet apart in public. Thank you. Please keep it up. It's working. And when it comes time to get your vaccine, choose to get immunized. It's the safest and most reliable way to stop the spread of the virus. Thank you, and now I'll turn it back to you, Governor Brown.
Thank you, Director Allen. And with that, Charles, we're ready to take questions.
Thank you, Governor. Our first question is from Lisa Balick with COIN. Go ahead, Lisa.
Governor, as Director Allen mentioned, everyone is admitting there's going to be chaos and confusion starting next week. Why does it need to be that way when other states have rolled out their vaccines for seniors and not having as much difficulty with chaos and confusion?
Well, Lisa, I have to challenge your underlying premise. Every state has had challenges with the vaccine rollout. In New York, seniors who signed up for vaccine appointments had them rescinded due to supply. In California, as you may be aware, website crashed and they had technical issues. And we've seen in the national news from Florida to Kansas City, seniors waiting in very, very long lines. These vaccines are the most in-demand product in modern history. I am delighted that so many Oregonians want to be vaccinated. And as Director Allen detailed, we have a lot of seniors and not enough vaccines. The good news is that we are receiving more vaccines from the Biden-Harris administration, and we can work quickly and efficiently to get all of our seniors vaccinated. We have additional vaccines to make that happen, and that's really good news. Again, I'm asking seniors to stay patient, but you will get a vaccine.
Thank you, Lisa. Our next question is from Amy Green with the Oregonian. Go ahead, Amy.
Yes, hi, thank you. Several questions. Can you tell me how next week's vaccines will be divided up between seniors, teachers, and inmates and others in phase 1A? I'm also wondering if you can provide a timeline for when seniors, educators, and phase 1A, as well as inmates, will be fully vaccinated, that is with 2 doses. And can you provide a vaccine schedule? I don't know if you have one that you can flip up on the screen. If you don't, if you can email it out, a vaccine schedule for when the vaccines will increase and how much Oregon expects each week.
Director Allen and Dr. Seidlinger, would you like to respond to that plethora of questions, please?
Yeah, I can tackle most of that, I think. We do have an allocation between the different categories. I don't have that right here in front of me, but we can send that out. In terms of the timeline to be fully vaccinated, it's pretty simple. If you received a Pfizer dose, you'll get your second dose 3 weeks later, assuming you come back and show up to get that second vaccine. And if it was a Moderna dose, it would be 4 weeks later. Of course, if the Johnson & Johnson vaccine is approved, that's a single dose vaccine, and so there would be no booster. And yes, we can provide our anticipated allocation of vaccines over the next 3 weeks that we've been given by the federal government.
Wait, so if you think that seniors and educators, you said, would be vaccinated by early April, I think maybe you're referring to a first dose. You're saying they would be fully vaccinated by early May?
Correct, yes. First, 75% of everybody who's eligible will be able to have received their first dose by early April. And then, 3 weeks or 4 weeks after that, depending on which vaccine they would have received their second dose.
And when do you think you'll be all done then to 100% of people who want it?
About 3 weeks later, I believe.
So the end of May for educators and seniors, fully vaccinated, everybody who wants it. That's the estimate?
That would be 100% of the eligible population being vaccinated. We don't think 100% of the eligible population will choose to be vaccinated. And so somewhere after that 75%, at or about that 75% threshold, depending on the population, we will likely have vaccinated everyone who wants the vaccine.
Okay. And then how about phase 1A and inmates?
Sam, that's the total of all of that.
So, just to give you a little bit more detail on our adults in custody, we have roughly 12,000 adults in custody at the Department of Corrections. As Director Allen detailed, we will be vaccinating them per the court order in tranches of 5,000 over the next couple of weeks. But we also have other adults in custody at the local level, as well as the young people at the Oregon Youth Authority that may be eligible. That population is roughly 300 people. I don't have the numbers of the adults in custody at the local level in our county jails. We'll get you that information.
And I believe OHA can follow up with you as well, but we have about a dozen of your colleagues in line. So we'll go next to Julia Silverman with Portland Monthly.
Thank you very much. Governor, in the past week or so, you've given several interviews suggesting that you will use all the tools at your disposal to help schools around Oregon open. I wanted to see if you could get a little bit more specific with us about what some of those tools might be. We know that in California, Governor Newsom has talked about financial incentives for school. In Maryland, Governor Hogan has said he will use every legal avenue at his disposal. In Ohio, they're only vaccinating teachers who have committed to returning to classrooms. I'm wondering which, if any, of those tools you might use, and if none of those, please be specific with us about what you mean when you say that. Thank you.
So since the day we shut down our schools, I've been fighting to get our kids back into the classroom. I am using, as you said, every single tool that I have available to me to make this happen. The pandemic has had horrific impacts on our kids, particularly our children of color and our low-income kids. I did have the opportunity yesterday to talk with Dr. Rochelle Walensky, the new director at the CDC, and she confirmed that we can do this return to schools safely. The tools that I am using include, we were fortunate in that Congress passed an additional allocation to help our schools at the end of last year. For Oregon, that's roughly $499 million that will be allocated to the school districts to purchase safety equipment, to provide additional support, and ensure that we have we have the safest conditions that we can provide under the circumstances. As you are well aware, we have our Ready Schools Safe Learners Guidebook. It is a 90 plus page safety protocol. It is one of the most rigorous in the entire country. In addition, we know that our schools will need ready access to testing and contact tracing. We have reserved the Binex Now tests for our school districts across the state to make sure that they have this ready. And the department is working with districts to make sure they have personnel trained to be able to make these tests readily accessible. The other piece, obviously, is vaccinating our educator workforce, including our custodians, our folks working in the lunchrooms, and our bus drivers that make sure our kids get back and forth safely to school. I am using my powers of persuasion. I am talking with both teachers and superintendents on a regular basis to hear from the educator workforce what their concerns are, and to work with superintendents to make sure that they can address those issues. I also have legal tools available. As I said, I'm going to use every single tool in my toolbox to make sure that we get our kids back into the classroom. They've been suffering as a result of comprehensive distance learning, and I know we can make this happen safely for our kids.
Thank you.
Thank you, Julia. Our next question is from Pat Duras with KGW. Go ahead, Pat.
Good morning. Thank you. Under the heading of a plethora of questions, why make seniors wait until Monday to be able to schedule? Sometimes it's hard for them to get around. They'll need to be getting rides, and that's not very convenient. Can they schedule using a phone number? Can they call? And why doesn't the state have one available? How many doses will go to seniors in the greater Portland area in the first week? And why not hold pop-up vaccination sites near where seniors live in the Tri-County area? Thank you.
Okay, Pat Doris, that was definitely a plethora of questions. And with that, I'm going to turn it over to Director Allen.
Thanks. I'll try to hit as many of those as I can. We can get you the number of vaccines for seniors going to the Portland metro area. I don't have that at my fingertips. There is not a single phone number that people can call to schedule an appointment. The reason for that is there are really 34 different ways of getting vaccinated with the different public health authorities around the state. Now, on the surface, it sounds like it's a good idea for there to just be one phone number, but the fact of the matter is how you get vaccines distributed in Harney County looks completely different than how it gets distributed in Douglas County, which looks yet different from Lincoln County and from the metro area. And so really having people connect with their local public health authority to find out what's the plan in that community is the most effective way to not try to impose a Portland-based one-size-fits-all system on the entire state. The convention center in the Portland area is not the only site that seniors will be able to be vaccinated. We talked about the federal pharmacy program that's going to put doses in retail pharmacies around the state. We're also allocating doses to local public health authorities, including Multnomah, Clackamas, and Washington County, that it will use independent of the convention center site to reach out to seniors who've got mobility issues or other circumstances that make it difficult for them to be able to get to the convention center site. And as supplies continue to improve, we'll broaden the use of those kinds of tools. For instance, subject to getting yet more federal vaccine supply, we'll open our state retail pharmacy program to provide more doses through retail pharmacies. That's the sort of thing we will be able to examine the ability to turn on if the Johnson & Johnson vaccine is approved, and we get some idea of how many doses to expect. I think I caught all the questions, but I'm not sure.
I was close enough. I'll let others ask questions. Thank you.
Great. Thanks, Pat.
Thanks, Pat. Appreciate that. Next up is Rachel Alexander with the Salem Reporter. Go ahead, Rachel.
Thank you. I'm hearing that Salem Health has not been allocated any first vaccine doses for next week, which means that they're not going to be able to roll out vaccinations for seniors in Marion or Polk counties. Could you explain why that choice was made and where those first doses are going instead?
Thank you, Rachel. I just want to give a shout out to our local public health partners. They're doing a phenomenal job working and delivering vaccines under really challenging circumstances. As I said earlier, as Director Allen said earlier, the good news is that our vaccine allocations are increasing. The Biden administration has committed to providing us with a level of certainty, at least in 3-week periods, which helps us provide numbers to our local partners. And as Director Allen said, each one of these local communities is doing this differently. For example, in Douglas County, Dr. Bob Dannenhofer is working, he's Director of Local Public Health in Douglas County. He's working with local providers to get seniors vaccinated through their providers. And then back in Marion County, also doing a phenomenal job, just like Douglas County. They have a really strong partnership going and have a extremely efficient process that can vaccinate thousands of Oregonians a day. And with that, I'll turn it over to Director Allen or Dr. Seidlinger to talk about the allocations specifically to Marion County for next week.
Yeah, I can I can take that, and I guess I would say 3 things. First, this next week is our serious pinch point in terms of vaccine availability, as vaccines are still being allocated to the Federal Pharmacy Partnership for people in long-term care. Of course, virtually all of those people are seniors as well, and so that's aimed at the same population. Marion County is has one of the highest rates of vaccination to date per capita in the state. And that also plays into how we do the allocations. There is significant vaccine being allocated to Marion County. It's going through the local public health authority. The local public health authority will work with how it's going to distribute those doses, which could include Salem Health as one option, and we're helping with those conversations. I do expect Salem Health to receive vaccine going forward, but that's the distribution as we sit today.
And could I get those numbers as well?
Yes.
Thank you.
Thank you, Rachel. Next up, we have Gary Warner from EO Media. Go ahead, Gary.
Yeah, hi, Governor and Pat and Dean, who we haven't heard from yet. But I wanted to ask how many folks who aren't in 1A and 1B have received vaccinations in Oregon for whatever various reasons. And I also asked last week about your turn down rate. What percentage of folks are not taking the shots? And OHA said they're not keeping those statistics. Whereas nationwide, we know that about 5% of doctors, about 10% of nurses are turning down these shots. Why don't we have those stats? That's it.
Thanks, Gary. I will just say this. We've worked to make very clear to Oregonians who's eligible for 1A and who's next in 1B in terms of our educator workforce, and starting Monday, seniors over 80. I think we all hate it when people butt in line, whether you're at the grocery store or any other type of line. And I just want to continue to say to Oregonians, thank you for being patient. This will take time, but the good news is the vaccine allocation is increasing. And I also want to encourage Oregonians to be respectful of their fellow Oregonians and wait their turn. And with that, Pat, I'll turn it over to Director Allen.
Sure. And so a couple of things. First, if you're seeing numbers out there of various percentages, you're seeing somebody who's done a survey or made an estimate or something like that. The federal system for tracking vaccines doesn't track the data that we would need to provide a definitive report on people refusing to be vaccinated. And as I indicated, I think before, we don't know who didn't show up, and we don't know why they didn't show up to get vaccine. And so we can do the same thing and do surveys, and we have done surveys, and our survey data indicates that about 40% of Oregonians are certain they want to get the vaccine. 40% think they probably want to get the vaccine, and that leaves about 20% with questions. And that's been a moving target. The national surveys I've seen have indicated that that more people are likely to get the vaccine, say they're likely to get the vaccine now than was the case before the vaccine was a real thing. And so I think you see people's attitudes change. And then I've also talked about the fact that there's a lot of geographic variability, even within professions. I talked to someone from one health system with multiple locations around the state who talked about very high uptake in the Portland metro area and very low uptake in Southern Oregon, basically amongst the same kind of a population. But there's not a system to track this data anywhere in the country that I'm aware of comprehensively.
But wasn't that part of the problem when you were trying to rebalance the vaccines? At one point, you brought the vaccines up to Portland. Do you have a better handle on that now so that you're not sending vaccinations to places that aren't using them at such a high percentage?
I don't know that I would use the word better handle. We think that the senior population uniformly is going to have a higher uptake of vaccine. But we do think that there is going to be a need at some point to recalibrate how we're distributing doses. Initially, we're going to be distributing doses based on percentage of the population in each county that's over age 65. But if it turns out that County A has a lower uptake rate than County B, and we don't have enough vaccine for County B, we will start making adjustments to those allocations to reflect that.
And last quick thing, the 75% of people at the end of May, that's 75% of the 1A all the people in 1A and 1B. You're not saying everybody in the state. Do you have any kind of handle on when that might happen? Everybody who wants it in the entire state?
Yeah, so just to be clear, it was early April to get first doses to 75% of everybody who is becoming eligible in the next several weeks. So 1A, education, childcare employees, adults in custody, and seniors. So 75% of that population, first dose by early April, and then as came up in Imy's questions, 3 or 4 weeks after that for a second dose. At the current rate of supply, I think that it's foreseeable that sometime around July, we should be able to have moved from other populations in 1B and into more the general public. Hopefully, the supply of vaccine will have increased significantly well before that, because those larger populations are going to be a lot easier to vaccinate if you're able to get a COVID shot like you get a flu shot, and it's pretty much available everywhere. I think I want to stick with what I've said before about getting everyone vaccinated and keep that kind of generally fall. I just don't think we know enough about future supply and future available vaccines to want to be more specific than that.
Thank you very much.
Thanks, Gary. We have time for just a few more questions, so we'll go next to Mike Zucchino with KDRV. Go ahead, Mike.
Hi, and this is a question for whoever can answer it, but according to Asante, they did not receive an allocation of vaccine this week, which caused them not only to cancel appointments for people over the age of 80 starting next week, but possibly putting in jeopardy the vaccination event where 9,000 people were due to get their second vaccination. Why has the allocation of vaccine to Jackson County been cut this week?
Thank you. I will turn that over to Director Allen for comment.
Yeah, and I'm not specifically familiar with the allocation in Jackson County, so I can't answer that directly. We'll have to follow up with you on that.
Okay, then let me ask you this: Are you because Asante told me that they can't even vaccinate right now. They couldn't vaccinate people who haven't had their first shot in phase 1A because they're concerned about their vaccination event for people to get their booster shot. Is the state pulling for counties that have done well, vaccinating a majority of people in phase 1A? Are you now pushing allocations to larger areas or other areas that may not have done as well?
Yeah, so I think we have to separate a couple of things. One is whether we're talking about this week that we're currently in for vaccinations versus next week when seniors become eligible. And we have to distinguish between having had access to enough doses and doing well. I think there's a misperception that if an area has certified to us, as I believe Jackson County has, that it had finished all of its 1A population and was ready to move into educators, that that's somehow, they're doing great. It's great that they're that far along. But what it means is they've had access to enough doses to finish that population. What we did for the week we're currently in is allocate vaccine away from counties that had told us that to counties like Douglas County that had not yet received enough doses to be able to finish their 1A population and work on their education population. So it's not a matter of penalizing those who are doing well. It's a matter of taking these scarce doses and getting them to places where not enough doses have been received yet to vaccinate people. This really gets to Gary's earlier question about different uptake rates in different parts of the state and how difficult it is to try to estimate that. And so we did some balancing this week that had a number of counties not receive doses based largely on their telling us previously that they were done with 1A to counties that told us that they were not. And that's a mix of urban and rural counties. Again, Douglas County is a good example. Moving forward, every single county in the state is going to get vaccine to do first doses starting next week. So I think the question I would have on the Asante question is, are we talking about this week or are we talking about vaccine for next week? And that's what I would want to look into and follow up with you.
So they should be getting vaccine. Jackson County, Asante should be getting vaccine next week.
I don't know that I would say Asante for sure itself, but every single county is getting an allocation of first doses next week. That's right.
Thank you.
Thanks, Mike. We have time for just 2 more questions. So we'll go next to John Hendricks with KPTV. Go ahead, John.
Are there any plans to scale back right now, like with the senior group? Why have such a quick ramp up in adding senior age groups over a month period when it's going to take 2 to 3-ish months to vaccinate those eligible? Would stretching that out help mitigate any anticipated chaos?
Well, thank you for the question. As Director Allen and I have both said, it's going to be challenging over the next couple of weeks, particularly next week, because we have a lot of seniors in that over 80 and over category coming online and eligible for vaccinations. But we took a phased approach in Oregon, increasing who is eligible on a weekly basis starting on February 8th. And we did that to try and avoid some of the nightmares that we've seen in other states when all seniors became eligible at once. Because as you know, there will not simply be enough vaccines. As we have detailed this morning, we are using all resources that we have in this effort, including deploying the National Guard to assist with 211 calls. The Oregon Health Authority has worked with Google to create a tool that seniors can go online and get more information about vaccinations. And obviously signing up for an appointment, as we've detailed, is going to look different in different communities. As I mentioned, Douglas County, you will be working with your local public health to be moved to a provider to get your vaccine. In Marion County, you've got Salem Health and local public health working together to get this done. So there's certainly going to be hiccups, but we will get through them. And I really appreciate our seniors being patient, continuing to stay safe, and understanding that we simply just don't have enough vaccines for everyone who wants them in these senior elderly populations.
Governor, if I could just add, one of the most helpful things that seniors can do right now is wait until their age band comes up to make calls and try to access online systems and all those kinds of things. If we can really leave the systems and the phone lines available for people who are over 80 only next week, that'll help a lot. And then only people over 75 the week after that, and so on. If people can just be a little bit patient, I think this process will work better.
All right. Thank you all very much. Charles, I think we're out of time. Please stay safe.